Imagine this. You are 72 years old. You live in Ohio. You have been on Original Medicare for 7 years. Never had a single problem. Never paid a hospital bill out of pocket. Last week, your doctor recommended a small procedure for your chronic knee pain, something he has done for patients like you many times before. You scheduled it. You showed up. You signed the papers the front desk handed you without reading them too closely. 3 weeks later, an envelope arrives in your mailbox. You open it at the kitchen table, and your hands start to shake. The bill says you owe $21,000 out of pocket from Original Medicare, the program you trusted your whole retirement to. How is this possible? You did everything right. You have Medicare Part A, you have Part B. You even have a Medigap supplement. So why is Medicare refusing to pay? If you are sitting at home right now, worried this could happen to you, please do not click away. Because what I am about to tell you is brand new. It started on January 1st, 2026, and most seniors have no idea it exists. Hello, my friend. I am Masha. I am a senior policy analyst, and I spend my days reading the fine print in Medicare rules so you do not have to. Here on TaxWise Seniors, my only job is to protect your benefits, your pension, and your peace of mind. Today, I am going to walk you through the new Medicare prior authorization rules for 2026. I will tell you the 6 states affected. I will tell you the 17 procedures on the government's list. And I will tell you the exact 3 steps you must take to protect yourself. But please, stay with me until the very end. Because there is one hidden mistake that seniors are making right now, a mistake involving a single piece of paper at the doctor's office that can cost you tens of thousands of dollars. I will reveal that mistake before we finish. Let me tell you about Robert. Robert is 68 years old, a retired plumber. He lives just outside of Phoenix, Arizona. His wife Linda is 66. They raised 3 children. They paid off their house, and they planned their retirement carefully. Robert has Original Medicare, not Medicare Advantage, Original Medicare. He chose it because he wanted to see any doctor he liked, without a network telling him what to do. In late January of 2026, Robert's back pain became unbearable. His doctor recommended an epidural steroid injection, a common procedure. Medicare had always covered it before. Robert trusted his doctor completely. The clinic scheduled him for early February. When Robert arrived, the receptionist slid a paper across the counter. She said, "Just a routine form, Mr. Robert. Sign here, please." Robert signed. He did not read it. Why would he? He had signed dozens of medical papers over the years. The procedure went fine. Robert went home. He thought it was over. 6 weeks later, a denial letter arrived. Original Medicare would not pay. Why? Because his doctor's office had not submitted something called a wiser prior authorization request before the procedure. And that paper Robert signed without reading? It was called an Advance Beneficiary Notice, Form CMS-R-131. By signing it, Robert agreed that if Medicare did not pay, he would. The bill was $9,000. Robert called Medicare. He called his doctor. He called his Medigap insurer. Everyone said the same thing. "Sir, you signed the ABN. You agreed to pay." Robert and Linda had to dip into their retirement savings, money they had set aside for their grandchildren's college. Gone. Because of one signature. Because of one form. Because nobody told Robert about a brand new rule that quietly started on January 1st. I do not want this to happen to you. So let me explain exactly what changed. The new rule is called the WISER model. The letters stand for Wasteful and Inappropriate Service Reduction. It was launched by the Centers for Medicare and Medicaid Services. The official launch date was January 1st, 2026, and it will run for 6 full years, all the way through December 31st, 2031. Here is the most important thing to understand. This rule only applies to Original Medicare, fee-for-service Medicare. If you are on a Medicare Advantage plan, this specific rule does not apply to you, because Advantage plans already use prior authorization every day. But if you are on Original Medicare, and you live in one of 6 specific states, you need to listen carefully. The 6 pilot states are Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. If you live in any of these 6 states and you are on Original Medicare, this rule affects you. The government estimates that up to 6.4 million seniors fall into this category. Now, what procedures are on the list? The government originally identified 17 service categories. They quietly delayed 2 of them. So right now in 2026, there are 15 active procedures requiring prior authorization. Let me name the most important ones. Skin and tissue substitutes. These are synthetic products used for chronic wounds, like diabetic foot ulcers or bed sores. The average cost of just one application reached over $21,000 in 2024. This is the biggest one on the list. Cervical fusion procedures, surgery on the bones of your neck, epidural steroid injections for back and spine pain. This is what happened to Robert. Knee arthroscopy and lavage for knee osteoarthritis, very common in seniors. Electrical nerve stimulator implants. This includes vagus nerve stimulators, phrenic nerve stimulators, and sacral nerve devices used for urinary incontinence, incontinence control devices, and services for the diagnosis and treatment of impotence. These are the procedures where, if you live in one of those 6 states, your doctor must request approval from Medicare before performing the service. Otherwise, Medicare may refuse to pay. Now let me clear up the misconceptions, because I have seen seniors lose thousands of dollars believing things that are simply not true. Misconception number 1. Prior authorization only applies to Medicare Advantage. That used to be true. It is not true anymore. Not in those 6 states. Misconception number 2. My doctor handles everything. I do not need to know. Wrong. Your doctor's office submits the paperwork, yes. But if they forget or they do not know the new rule, you are the one left holding the bill. Misconception number 3. If I am denied, my doctor cannot do the procedure. That is also wrong. Medicare can refuse to pay, but the procedure itself is still legal. The question is just who pays, you or Medicare. Misconception number 4. Artificial intelligence will automatically deny my claim. Not quite. The technology companies use AI to screen claims, but Medicare requires a licensed human clinician to make the final decision on any denial. So you do have human review on your side. Misconception number 5, and this one is dangerous. If Original Medicare denies the claim, my Medigap supplement will still pay. No, Medigap only pays when Original Medicare pays first. If Medicare says no, Medigap says no too. Now, here is the good news. You do have legal protections. Real official protections written into federal Medicare policy. Let me share them with you. First, you have the right to appeal. There are 5 full levels of appeal under Original Medicare. Level 1 is a redetermination by your Medicare administrative contractor. Level 2 is an independent review. Level 3 is an administrative law judge. Level 4 is the Medicare Appeals Council. And Level 5 is Federal District Court. You can fight a denial, but the clock starts ticking the moment you receive the denial letter. You generally have 120 days for the first appeal. Do not miss it. Second, you have the right to see any doctor who accepts Medicare. This rule does not change that. Third, emergency services are completely exempt. If something is a true emergency, prior authorization is not required. Period. Fourth, you can get free, expert help from your state health insurance assistance program. It is called SHIP for short. Every state has one. It costs nothing to use. And fifth, your basic Medicare benefits cannot be suspended because of this rule. This does not affect your Social Security check. This does not cancel your Part A or Part B. The only consequence is that one specific procedure may not be paid for, if the rules are not followed. Now, the hidden mistake I promised you. The mistake is the ABN, the Advanced Beneficiary Notice of Non-Coverage, Form CMS-R-131. This is the form Robert signed without reading. This is the form that turns a $9,000 denial into a $9,000 personal bill. When the receptionist hands you that paper at the doctor's office, stop. Read it. The form has options on it. There is an option that says you want the claim submitted to Medicare anyway, so that if it is denied, you keep your right to appeal. That is the option you want. Never, ever sign an ABN blindly. If you do not understand what you are signing, ask for a copy to take home. Call 1-800-MEDICARE or call your SHIP counselor. Do not sign that paper just because someone in a white coat is waiting for you to. Now, here are the 3 exact steps you must take to protect yourself. Step 1. Confirm your state. If you live in Arizona, New Jersey, Ohio, Oklahoma, Texas, or Washington, and you are on Original Medicare, this rule applies to you. Write that down. Tell your spouse, tell your adult children. Step 2. Before any procedure on the list, ask your doctor one simple question. Have you submitted my Wiser prior authorization, and have you received the affirmation decision back? Get the answer in writing if you can. If they have not submitted it, do not let them perform the procedure that day. Reschedule. Step 3. Keep every single piece of paper, every letter from Medicare, every form from the doctor, every denial notice. These papers start your appeal clock. Without them, you cannot fight back. Put them in a folder, label it clearly, tell a trusted family member where it is. And one bonus step. Save this number in your phone right now. 1-800-MEDICARE. That is 1-800-633-42227. It is free, it is official, and the people who answer are trained to help you. My friend, I have to be honest with you. This new rule is going to catch a lot of seniors off guard in 2026. The government did not send a letter to every Medicare beneficiary explaining it. There was no big announcement on the evening news. Most people will only find out when the bill arrives in the mail, and by then, it may be too late to appeal. Please do not rely only on YouTube notifications to learn about changes like this. YouTube does not always show you my videos, even when you are subscribed, so go directly to Medicare.gov, visit CMS.gov, bookmark AARP.org. Talk to your SHIP counselor at least once a year. Your retirement security is too important to leave in the hands of an algorithm. Yours or theirs. If this video helped you understand the new Wiser rule, please give it a thumbs up. It tells YouTube to show this warning to other seniors who need it. Leave a comment with your state so I know which of you are in the pilot zones. And subscribe to TaxWise Seniors so we can keep walking through these rules together. I am Masha. Stay informed, stay protected, and I will see you in the next video.